Hello viewers, welcome to our FB Live session. Today we have with us Dr. Jayalakshmi TK, Consultant Pulmonology at Apollo Hospitals, Navi Mumbai. Today we will talk about lung or pulmonary fibrosis. Doctor, my first question is, what is pulmonary fibrosis?
Thank you very much for having me here on the Apollo Facebook Live session. And what is pulmonary fibrosis or lung fibrosis? Is a very common question which is asked, and particularly after COVID, also patients have been told that they have lung fibrosis. So, we have an earlier term called pulmonary fibrosis, which is used for patients with terminal lung disease or end stage lung disease, in the sense it's a progressive chronic, means continuous condition, and it affects the lung, causing thickening of the lung interstitium, means the in between part of the lung between the air sacs and the blood vessels, that is the interstitium. So this gets thickened because of various reasons. Sometimes the reason is not found. Sometimes it is because of autoimmune illnesses like say rheumatoid arthritis or systemic lupus erythematosus. So these kind of diseases in which the cells of the body fight against their own cells. Sometimes it can be because of certain drugs. Sometimes it can be because of a malignancy. So these things can cause a problem in the interstitium and can lead to lung fibrosis. Can be because of radiation. So this is called as lung fibrosis, and most common is a type of lung fibrosis called as idiopathic lung fibrosis. Means here the reason is not known.
Doctor, what are the signs of pulmonary fibrosis?
Signs commonly of pulmonary fibrosis is breathlessness, which gradually increases over the years. Some feeling of fatigue or tiredness on walking, increase in breathing rate, and sometimes in the hand there can be swelling, which we call as a clubbing, and there can be a raised blood hemoglobin. So, and the oxygen saturation will be low. It will gradually reduce. It may be less than 95, 93, less than 90 also. And on walking, the saturation will fall further. So these are the signs of pulmonary fibrosis.
Doctor, is pulmonary fibrosis a terminal illness?
In a sense, it is. We cannot call it as a terminal illness, but we can call it as an end, as a illness which keeps on progressing, which does not really reverse back very easily. Especially if you count the idiopathic pulmonary fibrosis, or the one which there is no reason. Usually patients are little elderly when they get it, and the lung fibrosis or thickening keeps on increasing. So the lung shadows get worse, breathlessness get worse. Patient first goes on oxygen, then the patient becomes housebound, not able to go out of the house. Then patient may also require a BiPAP machine to support the breathing. So like that there is a relentless progression. There are medications, but these medications help to slow down the worsening, but they don't really help to reverse. This is for idiopathic. But for the other causes of lung fibrosis, like say eosinophilic or autoimmune, there can be medications which can reverse.
Doctor, are pulmonary fibrosis and COPD the same?
So pulmonary fibrosis and COPD are two completely different entities. COPD is usually caused because of exposure to some type of smoke. Either it can be cigarette smoke or it can be chula smoke. So these can irritate the lung lining and make the lung alveoli to become floppy and ineffective in the gas diffusion, like in taking in oxygen and leaving out carbon dioxide. So this is what happens in COPD. However, in pulmonary fibrosis, there is actually thickening of the lining of the lung, of the interstitial lining. So these are two different entities.
Doctor, what are the causes of pulmonary fibrosis?
So as I mentioned, the causes of pulmonary fibrosis, one common big group is idiopathic, where there is no cause found when you search also. The other causes is sometimes drug induced, because some drugs like methotrexate busulfan, some anti-malignancy drug. They can cause thickening of the lining of the lung. Then there are autoimmune causes like rheumatoid arthritis, scleroderma. So these can cause thickening in the lung lining. There can be there in some eosinophilias. It can be because of radiation therapy. So there are various causes which can cause thickening of the lung. Sometimes in COVID patients also, or in severe lung infection patients after recovering from a severe pneumonia or a severe ARDS like a viral infection, they can get or a sepsis where the body is recovering from severe infection and the lung has been affected with severe pneumonia. This can also lead to fibrosis. This is a type of fibrosis which is seen after COVID.
Doctor, what are the treatment options for pulmonary fibrosis?
So treatment options are, one is depending on the condition of the patient to give relief to the patient. So in the sense we do a lung function test. If the oxygen saturation is low, we give the patient oxygen. So this is one of the treatment options where oxygen is given to the patient. Patient is asked to take oxygen at least for 16 to 18 hours in a day. And he has to take the oxygen to try and keep the saturation above 90%. So this is one of the most effective interventions seen in pulmonary fibrosis, because in this condition the oxygen level always falls very low, usually falls very low. The second treatment option is some medications, like medications to slow down the progression of the illness. So there are medications like pirfenidone, nintedanib, which are anti-fibrotic agents which can slow down the progression of the fibrosis. Thirdly, there are medications which can, many often these patients have a pulmonary hypertension. Because of the lung fibrosis, there is a buildup of pressure in the pulmonary artery and cause pulmonary hypertension. So there are medications like sildenafil which reduce the pulmonary hypertension and give some relief to the patient. Then there are medications which can treat the underlying cause. Like if there is a drug which you think is cause, you stop that drug. If there is an autoimmune disease, steroids or other medications can treat. Or if there is eosinophilia, you can treat that one. So to treat the underlying cause, if any cause has been found. Then last but not least is the option of lung transplantation. This is a very important option because when you come to a stage where patient is on oxygen 24 hours a day, not able to have a good quality of life and the medications are not helping, then the only treatment option will be a lung transplant, so that this will give an additional 3 to 5 years of life for the patient.
Thank you so much, doctor, for giving us a valuable information. And
thank you. And I would like to also close with a concluding statement about COVID-related lung fibrosis, that this does not behave like the idiopathic pulmonary fibrosis which you read about on the net. Usually we are seeing that 80% of the lung damage because of COVID does get reversed between 3 to 6 months, and the remaining also improves gradually with or without medications. So this is on this heartening note, I would like to end today's very brief talk on lung fibrosis. Thank you so much.